Hi, I'm Dr. Joe Childs, and on this video today I'm going to talk to you about balance disorders, vertigo, and dizziness. If you're a senior and you're listening to this video, I'd like you to know that falls are the leading cause of accidental death in people age 65 or older. And vertigo is the third most frequent reason why people visit a healthcare professional. Vertigo, balance disorders, lightheadedness has challenged doctors and frustrated patients for years, and the reason why is because there's multiple causes and there's not many good treatments. In fact, most of the drugs that are given only work for a short period of time, and they eventually can make you worse. So today I want to talk to you about how we can change your life. If you're dealing with a balance disorder, we can help you. We can change your life using a non-drug, non-surgical approach. It's a revolutionary approach, and I'm going to discuss that on this DVD today. Let's talk about first the different types of balance disorders that are out there, because there is a large laundry list of these problems. The first one is what most people has heard of, is vertigo. Vertigo, you can have it with spinning, you can have it without spinning, you can have it where the room is spinning, you can have it where you're spinning. The second one that a lot of people have heard of is ataxia. Ataxia just means you're clumsy. It means that you just aren't so sure of yourself. The other one is disequilibrium. Disequilibrium basically means you have bad balance. You walk down the hall and you bump into things. You feel like you're veering off. You feel like when you get out of the car and you're ready to walk into a store, it's going to be a real feat for you to get there because your balance is off. The other one is visual vertigo. Now, visual vertigo works where when you feel pretty good most of the time, but when you walk into like a large room or the environment changes, or you look out over something that you're up in a high building, or you're looking out a window, you start getting sort of queasy to your stomach. You may start spinning or something like that. The other one is Meniere's disease. Now, Meniere's disease is a problem with the inner ear, and it can really cause a lot of balance problems. It causes some hearing loss, it causes tinnitus, it causes vertigo, and these patients really have an unsteadiness about them. The other one is sort of the vague complaint of dizziness or lightheadedness. You really can't put your finger on it, but something's off. Maybe you turn your head real fast and it feels like something gets blurry. So that's a big one that we see. The other one is Bppv. Benign paroxysmal positional vertigo. Now, this is a problem where you develop some otoconia debris that sort of break off in your inner ear, and what that does is it irritates the membrane in there, and it causes you to have bad balance, and it causes you to have vertigo. What will happen in this case, and see if this sounds familiar, you turn over in bed, and for about 15 seconds you are the room is spinning, you feel almost sick to your stomach, but then it kind of fades away. Or you're sweeping the walk, or you're shoveling some snow, and you turn your head real fast, and suddenly everything spins. It's really powerful, but it goes away in about 15 to 30 seconds. It might feel like you're being pushed. Some people with vertigo or balance disorders feel like they're being pushed from the left or pushed from the right. They veer when they walk. There's two types of vertigo. You have egocentric, which basically means that you're spinning, and you have geocentric. Geocentric is a type of vertigo where the room is spinning. The geocentric is better. When you have egocentric, it means that higher brain levels are involved. So if you're suffering with one of those conditions, and there's a lot more than that, the question is, what's causing it? Well, you have hard reasons for vertigo and you have soft reasons. Hard reasons are called ablative lesions. There are things like MS, there are things like tumor, there are things like stroke, high blood pressure that's left unchecked. So if you have these problems and you've not been to your medical doctor, I highly recommend that you go there. I highly recommend that you get some imaging, and get some MRIs, get a CAT scan. But here's what typically happens. People will go to their doctor. They may go to 3 or 4 doctors. They get their MRIs. They get their advanced testing. They may even get a testing where they put warm and cold water in your ear. And the frustrating part is most of those tests come back normal. Now, your doctor sits down with you and says, we really can't tell why you feel the way you feel. There's no problems. You don't have any tumor. You don't have any stroke. You don't have any MS causing these problems. And, after a while, you start to think you're crazy. People think you're crazy. No one's listening to you. People feel like you're making the problem up, and it gets real frustrating. Or maybe you go and they find out that you have Bppv, and you have the benign paroxysmal positional vertigo, and they give you a drug. They give you a drug called Antivert or Meclizine. And that drug may work for a while. Basically what it is it's a sedative for the vestibular system, but it doesn't fix the problem. They may give you some head exercises, but the problem keeps coming back. So this is where I come in. I come in when you have a balance disorder, when you have vertigo, and you've had MRI testing, you've had CAT scans, and nobody can really tell you what the problem is caused by. Because the problem is caused by what's called a soft lesion. I'm going to talk about that here in a minute. So what normally gives you good balance? Well, let's look at this chart here. You have inputs that go into your brain. One of the inputs is your visual system, how you see. It's very important to have a good visual system if you're going to have good balance and you're not going to be dizzy. You have your inner ear. In your inner ear, you've got these canals in there, and there's fluid in these canals. It's called endolymph. And what that fluid does is it tells you where your head is in space. So if you turn your head to the right or turn your head to the left, it lets you know where you are. And then you have your muscle and joint feedback system, which is information that comes from your body and goes up into your brain. You have the bottom of your feet. People with balance disorders almost always have some decreased sensation in the bottom of their feet. If you can't feel your feet, you're certainly not going to have good balance. And so balance and equilibrium is a complex interaction between all those systems. When they communicate together, when they match up, you're going to have good balance. You're not going to have vertigo. You're going to have good steadiness. Another area is the brain and the cerebellum. The cerebellum is the back part of your brain that controls your balance, it controls your coordinated movements, it controls all your spinal muscles, and the cortex. These are the two biggest causes for soft lesions or areas or people that have vertigo or balance disorders and nobody can find the problem. So it's not just inner ear. I repeat, it's not just inner ear. So what will happen is, let's say one side of your cerebellum is not functioning as well, meaning maybe it's weak on one side, or one side of your brain is not firing as good, it's not as strong, so it's kind of like a weak muscle. That can cause you to have poor balance and vertigo because there's an imbalance in the way your nervous system is firing. These things are processing stations. So all the information from all these systems here go into the cerebellum in the brain. And if those systems do not match up and they're not processed and they're not integrated properly, you have problems. You have chaos. You can't walk well. You're dizzy. You get nauseous. These are things that can happen. So how do we find out about that? Well, we do what's called a functional brain assessment. We're going to look at your eyes by putting a pair of these goggles on, and we look at them with an infrared camera. We are going to look at your eye movements. We're going to look and see how well they work. We're going to look at your spine, because your spine is the biggest integrator. We're going to look at your feet. Are your feet functioning the way they need to function? So we do this test in our office. And then what we do is we come up with ways, and we have over 100 different ways of drug-free ways of improving the way your nervous system is functioning. So we see people that have been told to learn to live with the problem. We see people that have never been given any answers, that when they get the MRI, there's nothing wrong. A couple home tests that you can do. I'm going to give you 2 of these to determine and kind of see if you have a problem going on. You can close your eyes, stand right in front of the bed, put your feet totally together so they're touching, and close your eyes. Now when you close your eyes, you should have good balance and you should be very steady. If you close your eyes and you almost feel like you're going to fall over, and do this with your spouse in front of you, of course, that tells me that the cerebellum's not working good. Another test you can do is you can take your fingers, your pinkies, hold them out like this, and you can close your eyes and you can try to touch your nose, but you do it with your eyes closed. Now, if you're having a hard time finding your nose, or you're kind of shaking like this or something like that, that tells me that the cerebellum's not working very well. So there are just a couple tests that you can do. We do a lot more testing in our office. So if you're serious about this problem, this balance disorder, this vertigo that you have, and you'd like more information, what you can do is page down on this website, and you can put in your name and information, and we will email out to you a full-length video so you can watch it. We're going to go over all the different causes of vertigo. We're going to go over all the different treatments that we do, and we're going to explain everything to you. So if you have a problem and you're sick of dealing with this, you're sick of people you're sick of not getting any answers, I recommend that you put your information in and we'll get that out to you as soon as possible. Thanks a lot.